here, do I? Take a seat. Right, thank you.
This is the pharmacy of the Royal London Homeopathic Hospital. In just 5 years, over-the-counter sales of homeopathic remedies, like those being prepared here, have more than doubled.
Right, have you had anything to do with homeopathy before, Mrs. Sigmund?
Not as a patient. I've known people who have been treated with homeopathic remedies, but not myself.
With some success?
Yes.
So that's why you decided to come and see us again. Haven't used any yourself?
No, I haven't. No.
At the same time, growing numbers of National Health Service patients have been requesting homeopathic and other forms of complementary treatment from their GPs. A very wide range of complementary treatments are available on the National Health at the Royal London. This programme will introduce you to the hospital, its people, and the therapies that they practice.
I came away from my medical education with a feeling of dissatisfaction, discontentment, a feeling that I'd understood an awful lot about how things go wrong, what actually goes wrong in the body when you become ill, but very little about why people become ill, why I became ill. If I got a cold, why was it? It was a virus infection, but why did I get the virus infection? Why didn't somebody else get the virus infection? Questions like this I felt hadn't really been properly explored in the medical education that I'd received, and so I started to look around to see if anyone else had the answers.
The resurgence in public interest in homeopathy has been accompanied by a growing acceptance amongst doctors practicing orthodox medicine of the value of homeopathy as both a complementary and primary form of treatment. This trend is encouraged by the rapidly expanding body of scientific evidence of the medicine's effectiveness.
For the first time, we do have good quality clinical trials, that scientific evidence, showing that homeopathy is effective when compared to other treatments, usually placebo. And this has been the big change. It's only really 10 or 12 years since there was any decent evidence. But now, very recently, 2 years ago, the British Medical Journal published a meta-analysis, that's to say a review, an analysis of all the studies they could find. They found a total of 107 studies, and 77 of those were positive.
I think research on homeopathy has had to ask a number of questions. One is, of course, does it work at all, particularly in the scientific sense compared to placebo? Then there's how does it work? And finally, in what way might it work in day-to-day practice? Could it be integrated into general practice? And the first of those questions, does it work, has been tackled mainly through the clinical trial. When I started my own work in the 80s, I thought there had been very little work in homeopathy, and throughout maybe the 80s, 3 or 4 trials hit the highlights. One would have been the work in the Lancet in October '86, done by my own team in Glasgow University and the Glasgow Homeopathic Hospital, where we compared hay fever treatment, active versus placebo medicine, using pollens. And this had a positive outcome, and undoubtedly its publication in the Lancet was something of a mould-breaking exercise. And in the years that followed, the Royal London Homeopathic Hospital and Peter Fisher here, in cooperation with Barts, produced some important work published in the British Medical Journal in fibrositis. And there was another very interesting work by Fairley in the British Journal of Clinical Pharmacology in the late 80s, with over 400 subjects in the treatment of flu, and again a positive result was produced.
Some of the most telling evidence that the positive results obtained by homeopathic doctors are based on something much more substantial than simple placebo effect can be found in veterinary practice.
When I qualified, I used a few remedies to start with, very tentatively thinking that it might have a place in practice, and I was surprised just what sort of place it took over in the end.
Now he is overweight. Yes.
The most striking results that Chris Day has achieved in his veterinary practice have been in the treatment of farm animals.
This herd was rather unique in the fact that the cows were split into 2 groups, equal sizes, not related to their milk yields or their ages or the date of calving, which made it a perfect place to start a trial. And in fact, the cows had been placed at random in groups of 40 on each side of the building. We put mastitis nosode and a 30th centesimal potency into the drinking water of one side, and we put a blank tincture into the drinking water on the other side. Mr. Reed didn't know which bottle was which. There is in fact no way of distinguishing between them visually. and he was putting the mastitis nosad in the one side and the blank unmedicated tincture in the other side. And during the winter we monitored the number of cases, and there was one case in the treated group throughout the winter, which happened very early on in the winter. And in the untreated group we had 19 cases out of the 40 cows, which was average for his usual incidence.
For the farmer, the success of the homeopathic treatments used on his livestock brings highly tangible benefits.
One of the key benefits from homeopathy is saving in money. There's various ways that it saves. There's cheaper treatments, and the biggest saving is through not having a withdrawal period for milk. And with antibiotics, every time we use it, we have to withdraw the milk and just throw it away.
It's not only in the treatment of pets and farm animals that major cost savings can be obtained. The Department of Health recently published figures to show that the costs of homeopathic prescriptions are on average half those of conventional drugs.
Experienced practitioners of homeopathy find that they can actually use homeopathy in up to 85% of the patient load. And it has been estimated that if this was applied throughout the country, it could save the National Health Service up to £70 million a year off the drug budget. It's also been estimated that the side effects of orthodox medicine are costing the National Health Service an enormous amount of money, something like £700 million a year, because some 10% of hospital beds every day are occupied by patients who are suffering wholly or largely from the side effects of drugs.
How do you feel homeopathy has benefited you through this time?
I think because it's looked at me as a whole person and my background, the family.
The holistic principle, treatment of the whole person, is at the heart of every form of therapy practiced at the Royal London.
We don't treat diseases, we treat sick people. And that means that we individualise and try to treat each individual as a unique whole.
I need to ask you some questions about yourself in a much wider sense.
We
So
think
it may
in terms,
sound
if you like, of
a little
seed
strange,
and
some of
soil,
those questions, but they all fit
where the soil is the person and the seed is the disease, and certain seeds flourish in certain kinds of soil.
Are you generally a chilly person or warm? I mean, in terms of your...
And by changing the soil, by changing the person's nature or constitution, you can improve the disease.
Do you find that the weather affects you particularly?
Do you mean in terms of sunshine and...
Yes, the sun.
In a homeopathic consultation, we're always looking to individualise the patient. We're particularly interested in what we call rare, strange and peculiar, what is abnormal about the patient.
Okay, now the difficult bit, which is I need a little bit about your character and your personality. If you could just tell me a little bit about...
Patients sometimes get upset when you start asking them about their mental symptoms because they think you're trying to tell them that it's all in their mind. But it's emphatically not that. It's because of this idea of constitution, of treating the person rather than the disease. And obviously the mental symptoms, the kind of person they are, the way they react to stress, their personality type is very important for establishing the constitution.
She's walking around and feeling fine so far.
Touch wood. Right.
But nothing really to...
All the doctors working at this hospital are conventionally trained and qualified.
Now, the drug we're talking about actually is a conventional drug, even though it's a fairly old-fashioned one now.
And will prescribe orthodox treatments and drugs wherever they are necessary. Medically qualified homeopaths are quick to emphasise that they are not in competition with their orthodox counterparts.
There are two kinds of medicine, but they're not, complementary and orthodox. They're not alternative and mainstream. They're good and bad. And the difference is, does it do the patient any good? And is it dangerous? Does it do any harm? So I think we are gradually seeing a shift away from this idea of labelling whether it's complementary or alternative or whatever, and instead an assessment as to whether it's good or bad.
Right, well, that's a good one, I think, at the trigger point as we did before.
At the Royal London, the practice of good medicine also means the integration of homeopathy with other proven forms of complementary medicine, as well as with orthodox treatments.
The sort of acupuncture we do here is not the traditional Chinese sort. It's a modern form, or a westernized form, if you like to put it that way. Essentially what we're doing is It depends a bit on the kind of problem. About 80% of the patients that we treat have musculoskeletal problems of one kind or another. And the mainstay of treatment with them is looking for what are called trigger points in the muscles and other tissues, and one or two other techniques as well, such as periosteal acupuncture. So that forms the main part of it.
I'm just going to check the movements of your head with me moving your head. Just relax as best you can. Let your head drop down.
In his orthopaedic medicine clinic, Dr. Adam Ward brings together specific forms of manipulation therapy with homeopathy and Western acupuncture techniques.
And this is a tender point. The reason these complementary therapies go so well together is that very often the patients that are coming here are patients that have already attended numerous other hospitals and are suffering from chronic pain. With chronic pain, very often patients will become anxious and depressed, may suffer from panic attacks. And the homeopathic medicine is particularly useful for treating this side of the problem. Just tell me where it's most tender. Here?
Because many of the diseases with which patients present at the hospital are in some way related to the stress of modern living, the hospital's doctors will often refer their patients for a program of mental relaxation exercises in Dr. Anne Bowden's autogenic training class.
It's actually a series of mental exercises or thoughts that you learn in a sequence over a period of the course, which is 8 weeks. And when you do your exercises, then you really switch into, I consider that you switch into another mental gear. And this is like an additional gear. It might be a gear that most of us use without knowing it when we switch into a relaxed state of mind. But for some of us, it doesn't happen very often. Some of us don't seem to be able to do it at all.
Homeopathy does not claim to have a treatment for every illness, but there's no question that homeopathic doctors often achieve remarkable results, frequently in dealing with disease that has proved resistant to orthodox medicines. The effectiveness of homeopathy in the treatment of allergies is very widely recognized, and doctors at the hospital offer a considerable variety of remedies for these debilitating afflictions. These include enzyme potentiated desensitization, an injection technique in which very small amounts of an allergen are injected together with an enzyme in order to boost the immune system.
But that won't last long. All right, are you ready?
In addition to EPD, there are a great many other forms of complementary treatment for allergy, and many are practiced at the hospital with considerable success.
You may feel slight stinging.
I was suffering from skin trouble for 25 years, and my local GP decided that the treatment that I was having had become dangerous, and the only alternative was alternative medicine. As simple as that. And it's totally cleared it up. I just come up here now for regularly 6 months check-up.
I came down here, they turned it round. They turned me round in a month. In a month they turned me round, you know. I mean, I'll get some sort of life now.
Allergies are also the most common disease presented by children coming to the hospital. But homeopathy is also highly effective in a great many other childhood disorders.
It's fascinating to watch small children respond in acute situations. You can see a temperature coming down within 5 or 10 minutes. You can see if there's been a major fall, you can see the bruising stop there and then. Having started off as a definite skeptic for homeopathy, I've swung right over to homeopathy, and I'd always use homeopathy as a first line of defence. If you have to go to the GP in the morning and get your antibiotic, you could still see, just stop it for a little bit, see if this is getting him better. Because if this gets him better,
you don't have to use.
You don't have to use the antibiotic.
There's wide awareness among doctors and the public of the effectiveness of homeopathy in treating allergies, skin complaints, and musculoskeletal disease. Less well known are the successes that have been achieved in many other areas. Infertility, for example, or premenstrual tension.
Well, we get a lot of referrals here because there's very little that you can do in conventional medicine that can actually either treat or cure premenstrual tension. It's something that's very, very difficult to try and handle, and also it's very common as well. Obviously there are dietary factors that can help, but a lot of the homeopathic medicines do help, and I'd say that that is something that we actually do treat very successfully. Most people, I'd say, are either very much better, either completely cured, or may have some symptom relief, and there's probably very few people who don't get any benefit whatsoever.
In addition to their efficacy in the primary treatment of many specific types of illness, there are also many instances where the supreme benefit that these therapies bring is a radical improvement in the quality of life of the chronically ill.
Chemotherapy and radiotherapy as my body can take.
We do not claim that homeopathy will cure cancer. To be fair to patients, it may sound negative, but I think it's only fair to put what we're offering in context. I'm sure we can help. We can help support quality of life and can often offer additional symptom relief, or sometimes offer an easing of symptoms which may be likely to develop during some forms of therapy. For instance, patients who get skin soreness during radiotherapy, often homeopathy can help with that. So homeopathy is there to give additional symptom relief and above all quality of life support.
Right. Did you feel slightly less breathless after that procedure?
I'm being injected with mistletoe, and I'm also on a stanum. It makes me feel fine, and I've got quality of life, which I never had before.
So it was the non-steroidal anti-inflammatories of various types that you had.
Had about 6 prescriptions, I think.
And they gave you indigestion.
Oh, well, I don't know what you call it now, but I call it gut-ache in plain English, and make them get down, yes.
Many patients are unwilling or unable to continue with conventional painkillers, and without an alternative that is safe and free of side effects, would be condemned to live indefinitely with their pain.
I have been on painkillers for a long time before I came here, and I went off, and then I had unfortunately thrombosis, and I had to go back onto painkillers, and I'm off totally of any kind of medication outside of homeopathy now.
In spite of all the research evidence, some general practitioners still refuse to refer patients for homeopathic and complementary treatments. There has also been a worrying trend recently for some health authorities to withhold funding for patients who are referred.
I was having treatment regular. Then my health authority in Birmingham stopped the treatment. They refused to authorise the visits. So we wrote to the Prime Minister, we wrote to 3 MPs, local MPs in Birmingham, with the Chief Executive of the Health Authority, and eventually we managed to get it back. But while I was waiting for this to happen, I was going backwards.
The management of the Royal London sought and were granted trust status in order to guarantee the hospital's independence and reverse this trend.
Last year we did a patient satisfaction survey where we sampled 500 patients. Now, very interesting, about 60% of that sample had not realised the service that we offered was available on the National Health Service. And they'd come to us by other routes, through friends or just reading in newspapers, not through their, eventually they managed to get to their GPs and be referred by their GPs to us. So that's an area we've really got to promote, make people aware that the service is available on the National Health Service, and trust status will allow us to do that.
The new trust is currently developing a sophisticated computerised audit system and plans as a first step to greatly enhance the service that it offers in 3 particular areas of complementary care.
One key thing that we're going to do is looking at complementary cancer care. Now, we already provide that service, but we can develop it even more. Now, we can't cure patients with cancer, but we can certainly improve their quality of life. Another area that we want to promote is orthopaedic medicine. Now, the country suffers with people who just take a lot of time off of work and suffer from chronic pain because of these conditions. And orthodox medicine doesn't seem to be helping them. Now, we can. Children do very well if they're treated with homeopathy, especially those children who suffer from asthma or nasty skin conditions. We've had very, very good results. We have long waiting lists at the moment for children to be seen as outpatients at the hospital, and that's something we really need to reduce, and we need to promote the services that we offer for children.
There's no colour.
Complementary therapies have a valuable role to play within the NHS, and institutions like the Royal London Homeopathic Hospital must be permitted to continue to flourish as centres for education, research and the practice of a particularly benign form of medicine.
Too many chemicals are used in orthodox medicine, too many involved drugs which have very offensive side effects, even when they're not abused, as many of them in fact are abused, like antibiotics and tranquilizers. Homeopathy is a safe form of medicine, and it certainly doesn't claim to cure everything, but it certainly should be given its chance. NHS patients should be able to benefit as patients able to pay in the private sector. This hospital is about NHS patients.